Hello and welcome back to Flipped Psychology. I'm Miss Lee and we are finishing up Unit 6, Psychological Disorders. In Section 6, we'll be talking about treatment of psychological disorders. Our objective is to describe the availability of treatment for psychological disorders and the impact of treatment options on society. If you haven't done so already, go ahead and grab your notes and let's get started. So let's first talk about psychological therapies. One of the first people to really utilize what we now call talk therapy was Sigmund Freud, and he is the father of psychoanalysis. Freud used techniques like free association, hypnosis, and dream interpretation in order to gain insight into the client's unconscious. Using psychoanalytic methods, psychotherapists use their techniques to overcome resistance by the client. Basically, what that means is that there is an expected pushback on trying to make deep changes in the psyche in order to move forward. The psychoanalyst wants you to become aware of the resistance and together interpret its underlying meaning or its latent content. In psychoanalysis, the client transfers to the analyst emotions that are linked with other relationships. So they're able to work through these deep-seated, often latent issues through the transference of feelings about a parent or sibling or some person in their history that they're not able to directly face. The general term psychotherapy is an interaction between a trained therapist and someone suffering from a psychological difficulty. Another type of therapy is humanistic therapy, and in this type of therapy, the focus is on the person's potential for self-fulfillment, also known as self-actualization. They focus on conscious thoughts, not unconscious ones. The focus is on the present and future, not the past. And in humanistic therapy, really the objective is to take responsibility for your actions instead of blaming childhood anxieties. So it's really kind of the opposite of psychoanalysis in a lot of ways. Carl Rogers is a huge figure in the humanistic movement, and he developed client or person-centered therapy. This is the most widely used humanistic technique, and I would argue that it's one of the most widely used techniques, period. The therapist should use genuineness, acceptance, and empathy to show what we call unconditional positive regard towards their clients. Central to Rogers' client-centered therapy is active listening. In active listening, there is empathetic listening where the person echoes, restates, and clarifies what has been said by the client. Another type of therapy is behavioral therapy, and this type of therapy applies learning principles to the elimination of unwanted behavior. Basically, in this type of therapy, the behaviors are the problem, so we must change the behaviors. You may recognize this person. This is B.F. Skinner, one of the founders of behavioral therapy. So then we get to kind of the next iteration of behavioral therapy, which is the combination of cognitive therapy and behavioral therapy. So we kind of have this merging of therapies that we now know as CBT, cognitive behavioral therapy. In this therapy, people are taught new, more adaptive ways of thinking and acting based on the assumptions that the thoughts intervene between the events and our emotional reactions. So it's very much based on a cyclical type of pattern whereby an interruption in any of the pattern could result in a change in the outcome. Aaron Beck was a key player in cognitive therapy, and basically Beck noticed that depressed people were similar in the way they viewed the world. So he used cognitive therapy to get people to take off the dark sunglasses, so to speak, in which they view their surroundings. So basically the question is, does cognitive therapy work? Research that has been done on people who experience depression actually do show a decrease in depression scores over time. So when you take someone with a pre-therapy test and compare people who have had the training against people who are still on the waiting list, when you administer the post-therapy test, you see a significant drop in these depression scores. Then there is an eclectic approach, and this is the most popular form of therapy, if you really can call it a form. It's basically a smorgasbord where the therapist combines techniques from different schools of psychology. So they take things that are going to work for that client or that family or that couple, and they use different techniques to make up a treatment plan for that client. All right, so let's talk about the biomedical therapies. These are therapies aimed at altering the body's chemistry or anatomy. Psychopharmacology is of the effects of drugs on mind and behavior. And then electroconvulsive therapy, or ECT, is biomedical therapy for severely depressed patients in which brief electric current is sent to the brain of an anesthetized patient. So the person is asleep nowadays when this procedure is done, and it is still done. The last therapy that we're going to talk about is EMDR. This is where the therapist attempts to unlock and reprocess previous frozen traumatic memories by conducting therapy while they're waving a finger in front of the eyes of the client. There has been a lot of fanfare about EMDR, but at this point, we really lack the research behind it to say whether it is an effective treatment or not. All right, so we've talked a little bit about the treatment of schizophrenia. Much like the treatment for all psychological disorders, the treatment of schizophrenia has come a long way. We started out the course talking about some of the historical treatments, and those included lobotomy and insulin shock therapy. Current treatment for schizophrenia is usually a combination of therapy and medication, and you see on your screen some of the more common medications used in schizophrenia. These medications are from the family of antipsychotic medications. So this should be review, but let's talk about what lobotomies are. This procedure consisted of a doctor cutting the connections to and from, or simply destroying the prefrontal cortex. While not the first to use lobotomy, American physicians Walter Freeman and James Watts adapted a technique that was already in use to create the Freeman-Watts technique, or the Freeman-Watts standard prefrontal lobotomy. About 50,000 lobotomies were performed in the United States, and Freeman himself performed between 3,500 and 5,000. The practice started subsiding in the mid-1950s as scientists developed antipsychotic and antidepressant medications that were much more effective. Nowadays, mental illness is primarily treated with drugs. In cases where drugs aren't effective, people can be treated with electroconvulsive therapy. The process of lobotomy would basically involve the doctors accessing the frontal lobes through the eye sockets instead of through drilled holes in the scalp. That's where it started. Freeman really revolutionized the lobotomy by accessing the brain through the eye sockets. And in 1945, Freeman took an ice pick from his own kitchen and began to test the new surgical technique on cadavers. The technique involved lifting the upper eyelid and placing the point of a thin surgical instrument under the eyelid and against the top of the eye socket. And then a hammer was used to drive the pick through the bone into the brain. It was then moved from side to side, severing nerve fibers connecting the frontal lobes to the thalamus. It's important to note that this was done without any type of scanning or the ability to see what the doctor was actually doing inside the brain. So let's talk about other kinds of therapy. We also have group therapy. Group therapy normally consists of somewhere between 6 and 9 people, and they attend a 60 to 90-minute session that can help more people and often cost less. Clients are able to benefit from knowing that others have similar problems. Group therapy is led and facilitated by a licensed therapist. This is different from a lot of processing groups like Al-Anon or AA, where really it's not meant to be a therapeutic group as much as a support group. Family therapy treats the family as a system, and in this type of therapy, the therapist guides family members towards positive relationships and improved communication. Those are key to improving the family dynamic. So an interesting research study that I wanted to talk to you about is the Rosenhan study, and the name of this study is called Being Sane in Insane Places. Basically, this is a study that was done back in the 70s, and Rosenhan and his associates would attempt to be admitted into a psychiatric hospital. What they did, and only what they did, was to describe the symptoms of hearing voices saying hollow, empty, and thud. Rosenhan and his associates were all admitted into 12 different hospitals across 5 different states. They were all admitted for schizophrenia. Once they were admitted, they stopped showing symptoms altogether. None were exposed as imposters, although there were suspicions, and they were all discharged with the diagnosis of schizophrenia in remission, which is not the same thing as being cured. Okay, so let's review. In this video, we talked about the treatment for psychological disorders and the impact of treatment options on society. In our next video, we will be starting a brand new unit, social psychology. I can't wait to see you then. Bye for now.